Hi, my name is McKenna Kenneth. I'm an 8th semester nursing student. Today is January 20th. I'm going to be sectioning trach as well as trach care. Before going into the patient's room, I make sure I have all supplies needed. I make sure I have my suction sterile kit, 2 pairs of sterile gloves, a clean towel, and a trach care kit. I would also have a resuscitation bag at bedside if needed, and an obturator as well as a tube a size smaller. The patient's vitals have all been checked. They're within normal range. I have listened to the lungs and monitor the patient's cough and deep breathe. He knows to raise his hand at any time for a form of communication if he needs to stop. Suction is turned 80 to 120, and the patient is being hyperoxygenated. Hello, Mr. Smith. My name is McKenna. I'm going to be your student nurse today. Can you tell me your name and date of birth? Good. So remember, anytime you need to stop, go ahead and raise your hand. I'm going to set you up, semi-Fowlers. And I'm going to place this towel across your chest. This time, I will set up my sterile field. Okay, this section will be inserted about 5 inches, and I will pull out 1 to 2 centimeters before I start doing intermittent suctioning to prevent damage to mucous membranes. I will suction for 10 to 15 seconds in circular motions as I remove the section, and I will only do this for a course of 5 minutes, and giving the patient breaks about 30 seconds to 1 minute before suctioning again. At this time, I will test the suction. Okay, Mr. Smith, take 3 to 5 deep breaths for me. And I'm going to remove oxygen. At this time, I'm going to insert in about 5 minutes or 5 inches or until I meet resistance. And then I will remove, going 10 to 15 seconds of intermittent suction, going in circular motion. Give the patient 30 seconds to 1 minute at least. If they need longer, I can give them longer. And go ahead and insert in again. And removing 10 to 15 seconds in circular motion. At this time, I can go ahead and remove the dirty dressing, put the oxygen back on. I will turn the oxygen down to back to pre-suction settings, and I will turn the suction off. I will document how much drainage I obtained from the suction, as well as how the patient tolerated the procedure. Before changing the dressing, the respiration status will be monitored, and check the pulse as well. Go ahead and set up my sterile field. I will pour normal saline into 3 compartments. And then the first compartment will be a 50-50 mixture of normal saline and hydrogen peroxide. At this time, I can pull off the oxygen and remove this and set it in the hydrogen peroxide and normal saline mixture. While that's setting, I can remove oxygen down it. And go ahead and clean over the trash can. Dispose of that and set this in the normal saline second compartment. I will let that soak in normal saline. I will then pick it up with my dominant hand. I will then use one of these in the normal saline last compartment to clean around the area. Can dispose of that and then get a dry one to make sure the area is good and dry. At this time, I'm going to put the new dressing on. I will dispose of that. And at this time, my fingertip did touch the gown a little bit, so I would discard of these dirty gloves and put on new sterile gloves. And I am ready to change out the tie. Making sure to keep the old one on to prevent the trach from coming out while I'm changing out the tie. Okay, I can put the oxygen back on the patient, remove the towel, lower the bed, make sure the patient is not in any pain, doesn't need to use the restroom, give the patient a call light. I will document how the patient tolerated the procedure.